Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, once again with my faithful co-host, Dr. Millicent Ravello.
I am faithful.
You are.
Faithful and I'm loyal. Thank you.
Happy to have you here. It's going to be a very good podcast because we're going to talk about the first big plastic surgery meeting that we attended since this pandemic started.
It was so nice. It was so nice.
It's good.
It was good.
It was really good.
So the aesthetic meeting is what it's called. It's the annual meeting for the Aesthetic Society, which is sort of the main big organization of aesthetic surgeons in the United States and, actually across the world, because we do have international members as well.
We do.
And typically we have an annual meeting every year, someplace nice, and everyone goes and you see your colleagues and old friends and you learn a lot of stuff, and it's really great and it's a good time and everyone looks forward to it.
You learn a lot.
You learn a lot. Last year was COVID, so it was supposed to be in, where was it supposed to be last year? Vegas.
That's right.
It was supposed to be in Vegas last year in May. It's usually in May, and that was right when COVID hit, so it was canceled. And then this year, they opened it up for in-person. They limited how many people could attend, and they had social distancing and mask requirements, but it was a great time.
Yeah, it was a great meeting. I was glad that we got there from, the Beverly Hills contingency. We were, sort of in the mix with that, especially.
We were well represented. Beverly Hills represented.
Yeah, definitely.
And I should say, so not even more importantly, but equally importantly, it was in Miami, which was incredibly fun and such a great place to go and visit.
Right. They don't have COVID there, evidently.
They don't.
Which makes it very easy. And since some vaccinated brethren like us show up there, we were totally cool.
It made it for a very low-key, low-stress situation because the majority of the people attending the event were in the medical profession. So we've all been vaccinated for months now. And then the city and state itself had its own mask mandates for indoors, especially the hotel and the convention hall. But outdoors, there really was no requirements that I saw.
No.
Yeah.
And they were vaccinating. I mean, there was a vaccination center, like literally you walked out of the convention center and they had a vaccination place there. So if you were shy of a vaccine, you could walk over there and just go get it.
Get one.
It was all set. So, but the meeting was great. The American Society for Aesthetic Plastic Surgeons, which is is it becoming the Aesthetic Society?
It is. Yeah, the old name was American Society for Aesthetic Plastic Surgeons, ASAPS. And then that's kind of a mouthful. So they've now shortened it to just the Aesthetic Society.
So that's the deal now.
That's the deal.
Well, that's good. I wasn't there for the business meeting for that formal resolution passing, but that's okay. We did make it to our business meeting.
You did. You dragged me to the business meeting. I was like, I want to go to lunch. You're like, you have to go to the meeting's member.
Yeah, I mean, you're a member. That's the business meeting.
I know. And I'm glad I went. I voted aye, and I participated, and I'm really glad I went.
I think I seconded the motion.
So thank you for making me go to the members meeting.
What was your biggest take home? What did you really come out of there saying, wow, that's great. I'm totally going to do that in my practice?
You know what was interesting about this particular meeting this time around is that for the first time, they had a whole mini symposium on aesthetic breast reconstruction. So historically, breast reconstruction has fallen under the reconstruction umbrella of plastic surgery, and that typically occurs at the ASPS meeting, which is a more academic, reconstructive oriented meeting, and that's where people talk about breast reconstruction. But this year, they introduced an aesthetic breast reconstruction course symposium. It was half a morning or half a day long. And they talked about the fact that breast reconstruction is very much aesthetic, and you can't ignore that fact about it. And so that's what I really enjoyed going to, because I do so much of that, and learning different techniques on how to make a breast reconstruction as aesthetically pleasing as possible. It's not just throwing some implants in there and saying, oh, you have breast mounds. Like, it's really about making it look like they never really even had a mastectomy.
Yeah, I think that was a really great point because, as you said, the breast reconstruction has sort of always been relegated to the ASPS meeting, the plastic surgery, the meeting, which is typically in the fall. which I think is coming up soon.
Yeah.
Yeah, where's that going to be?
Atlanta.
Atlanta. We got to go to that.
We should totally
We gotta go. I love Atlanta. I am a huge Buckhead fan. So yeah, I think that bringing that in was great. I thought it was great that they brought in the. They did a lot of like the BII stuff, breast implant illness. I thought that was an interesting morning.
Yeah, so that is a newer topic on the horizon, breast implant illness, and a spectrum of diseases or symptoms that patients who have breast implants can experience. And it's a very controversial topic because we don't have a lot of scientific evidence on it. But so this was a good way to sort of open up that discussion amongst plastic surgeons about what evidence we do have for it.
I thought it was great. I thought, that they really are trying to drill down and get the evidence, and it looks like, more data is needed, but, people are definitely going to continue getting explants. I mean, obviously, we know that textured gel implants can cause, very weird tumor in very, very small numbers of people. So why can't breast implants cause somebody to feel sick from them? That's also the big question. Right. So they're really trying to drill down and get the data on that. For most people, breast implants are totally benign and fine. For most people.
99.99.
Yeah. So it's a very small number of people that have these issues, but they do have them, and they're impossible to ignore. So I think that was very valuable that that the Aesthetic Society has chosen to make that part of the curriculum for plastic surgeons to learn it as a really important core part of the specialty. I gotta say, my favorite part of the whole meeting, though, was the plastic surgery fellows bowl.
Oh yes, yes, we gotta ring your bell on that one. The plastic bowl. Yes. So this was a competition amongst plastic surgery aesthetic fellowships. Well, you're gonna spoil the punchline.
Okay, sorry. I'm just
patience.
Shh. All right. Sorry.
And there was 4 fellowships represented, of which the Rocks Surgery, the Marina Rocks Fellowship, was one of them. The other one was out of
our fellow, of course, Justin Incredible Perez.
Incredible. He was our representative. And then there were 3 other programs. NYU.
Represented by Stelios Wilson.
Yes.
And then there was the
Houston.
That's right, the fellowship from Houston, which I wasn't familiar with.
Yeah.
But evidently they have like a zillion surgeons there.
Yeah.
And then also it was the one from North Carolina, from Charlotte, which was Dr. Hunstad's fellow.
Yeah, and so the fellows got up there and gave presentations. They had 3 assigned topics. The first one was, I think, what I learned, or the most important thing I learned in this fellowship.
The biggest pearl from your fellowship.
From the residency, from the fellowship. And then the other one was the interesting case that they were involved in or did themselves. And then the third one was
the best practice
This
was
why that guy got
NYU took a
eliminated.
5-minute major on this one.
Yeah.
There was practice management pearl.
Right. So not necessarily the clinical, scientific, surgical aspect, but the business management technique of the practice.
Right.
So there were
Stelios
3 things.
took a big hit there because I think he just misinterpreted the question, but still he didn't answer the question. He showed that he thought that adding liposuction and fat grafting to basically any body procedure was very helpful, but it wasn't practice management.
That's not a practice, that's a clinical pearl.
No, that was a clinical pearl, and so they penalized him fairly heavily for that. And
which allowed Team Beverly Hills to sneak ahead and win that cup.
It was very big.
Literally a plastic bowl.
It's called the plastic bowl because the prize was a plastic bowl.
A plastic bowl.
And there
held
it is.
In place by gum?
I think it's
glue?
putty or gum.
Elmer's? Not sure.
I think Bill Adams may have chewed this gum and stuck it on there, and then that's it. But this thing weighs a lot.
It does.
I don't know where they got this thing from, but it was heavy in the suitcase. I had to bring it back because there you have it, the plastic bowl.
Just Incredible and Dr. Calvert for the win on that one.
And they did weigh in the attendings' input. Yeah. That was part of I had to represent if we were going to win that thing.
Well, you represented well.
It was good.
You took it home.
I was very happy, very proud of that. I was also on the that rhinoplasty panel, which I thought was good too. You didn't see that though. That was when you were doing a breast thing.
I did mostly breast stuff. I did breast, and I did some aesthetic genital surgery.
I know I walked in at the wrong time.
Yeah.
On that.
What am I looking at?
I was like, wait a second. Where am I? I just thought it was rough, but it was very helpful, actually. I was glad I saw it because, as plastic surgeons, our patients ask us to do everything. And I do some number of labiaplasties every year. And so watching experts talk about how they think about it was really useful.
It was. There was one doctor who was talking to her about her technique for actually doing vaginoplasties, tightening up the actual vagina itself with internal sutures. I have not done that. I've never ventured into that territory. So it was really interesting seeing how she was doing it. And she does a lot of it. When you think about it, if plastic surgeons aren't doing it, there's very few gynecologists that are doing it. So there's sort of this void.
Was she doing an AP repair?
No, she was literally just going in there and de-epithelializing or removing a portion of the mucosa of the vagina and then suturing it back together to make it tighter. I think she was doing some perineal repairs as well, but what I mainly saw was the intravaginal ones.
Yeah, that's not the nose.
That is a long way from the nose.
That's not the mid-face.
It's a different vestibule, yes.
Not happening. I don't mind doing the labiaplasties and clitoral hood reductions and things like that. I do a fair number of those, and I like doing them. I think it's a very satisfying, rewarding surgery, for the patients, and for me, it's very artistic. I think it's a cool operation, and doing it where you don't have problems, I think is actually challenging.
It is. There is definitely a learning curve to those. So sitting there with the experts and listening to their techniques and pearls and things they've learned over time is really helpful.
Yeah, it was good. The rhinoplasty panel was good. You probably have seen most of it. It was this new discussion that's come up over the last few years of whether preservation rhinoplasty or structural rhinoplasty are advantageous, and sort of the take-home message was, well, you should know both. It's you can't make every operation with some certain technique. And I'm just gonna not go off on this because it gets me. I think you can see the flames starting to well up in my eyes and smoke coming out of my ears. The truth is that when people try to sell techniques as a way to say that their operation's superior or whatever, it does make flames come out of my eyes and smoke come out of my ears, because it's not true. The reality is the results should be what get people in the door. People should come for the results. I want that result. You seem like you get a lot of those good results. I'm going to have you do my rhinoplasty.
Right.
Not
how you get
use
there.
You use some special saw, or evidently you have a special cucumber water that you drink before you operate. Maybe I should have you do my rhinoplasty. Well, do you like the results? Because that's what matters, people.
Right. Not how you got there necessarily.
No.
Right.
You drove here in a Bentley, so I should have you do my rhinoplasty. No. You should look at the before and after photos, and you should decide if you like those before and after photos, and that's how you pick a surgeon, because that's what you're going to get.
Agreed. But nevertheless, it'll be a topic. I'm sure there will be another panel next meeting about preservation rhinoplasty. I can predict it. I'm pretty sure it'll be there. So you'll have another chance to say your piece.
I mean, I think preservation's cool. I'm totally into it. I think it's awesome. I'm like a technique meister. I collect techniques. I love picking up new techniques. And I think the preservation stuff is slick and cool. It doesn't mean that I'm going to do it on every single patient. I can't do preservation rhinoplasty on secondary patients who've had osteotomies and septoplasties. That's not even on the discussion table for me.
Yeah, nothing to preserve there.
No, it's over. They need a total overhaul. So people are oh, you should try preservation. I was dude, 60% of my patients are destroyed by somebody else, and I need to fix them. It's not going to be something that comes up on every single case. And then on my primaries, I just want to get a certain result. If they're great for preservation, I'll do it. But I can tell you I've done 6 of them or so, and it's I do a lot of rhinoplasty. Yeah. So
yeah, you do the math.
It's I've done 6. It's not I got to hang my whole hat on well, I do preservation rhinoplasty, so I'm better. No, it's look at the results. It's about the results. And I mean, if there were a way that what would be great is to have people have a scoring system, like here's a primary rhinoplasty and the degree of difficulty on this one judged by the experts, or the system that says this is a degree of difficulty of a 7 because it has a dorsal hump and it has alar malposition and it has a hanging columella and it has a previous, an septal deviation and it's a high septal deviation and the nasal bones are asymmetric and then there's a low radix and it needs a graft. So all those things go into it. And now this primary rhinoplasty is a 7. And Dr. Calvert did it, and here's the result. You go, wow, on a primary rhinoplasty for the degree of difficulty of 7 out of 10, that's a great result. And then here's a 1 or a 2. And then people could actually start to look at photos in a way that would be constructive and helpful for them making decisions. Instead of saying like, I do scarless rhinoplasty. That doesn't help anybody. There's like 42 practices in this country that are advertising scarless rhinoplasty, which is like, I do endonasal rhinoplasty. Well, I do endonasal rhinoplasty. Should I advertise I do scarless rhinoplasty? No, it's all about results. And that's why this preservation versus structural discussion for me is like boring. It's like, great, congratulations. Like, I think it's cool too, but I'm not going to hang my hat on it that's how you have to do rhinoplasty to get great results. Okay, I'll get off the soapbox.
Well, I'm glad
now.
you decided you weren't going to get riled up.
I wasn't going to get into
that.
it, so I'm going to shut up now and actually Sean, cut that whole thing. No, I'm just kidding. Sean has just a bitch of a job editing these things. I really feel for him.
Sorry, Sean.
He just listens to him and goes like, oh, here he goes again. Because he has to listen to all these. You know that. As the podcast editor, your job is to listen to the whole thing and decide what stays, what goes, and how it should sound. But we have an incredible producer named Sean Gosser, who is really he's the best there is really in podcasting. I mean, he's been doing it longer than anybody, and podcasts are truly in their infancy. And so that's why, I think it's good that we've been doing this for quite some time, so people can get something out of it. And I think we're able to distill things down about like a meeting or something like that.
Well, we had wanted to take our podcast mobile and do a podcast in Miami. That was what we really wanted to do, but there ended up not being time. But the whole thought was we'd kind of go on the road with it and talk to people in Miami and get their impression on plastic surgery, because obviously plastic surgery and aesthetics in Miami are different than Beverly Hills or in Houston or in New York. Different. So it was a cool concept. We just never had the time to actually do it. But I will say the one thing I noticed amongst the plastic surgeons who are from Miami, who spoke at the conference, and then just also being in Miami and going out and about, there's a big emphasis on butts. Butts are huge in Miami, like literally and figuratively. Butts are huge. But I mean, we were staying, in Miami.
They want them big,
and they just let them hang out. You're going like down the street, optional. like literally pants optional.
It is. I mean, they wear like 2 strings across their back and then like a Post-it note, and that's like their bikini.
Yeah, but then they're walking down the street.
Right,
like
exactly.
It's one thing on the beach. Like, sure, fine, you're on the beach. Like, let it all hang
like
out. But this is on the street. They're going to the restaurants, and they're in their, thong bikini with like a piece of mesh covering them.
It is. It's like,
or they have these shorts which are covering like half their butt, which I think is amazing, and I love it. And I kept like swiveling my head around and being like, "Ooh, look at that one!" and "Ooh, look at that one."
Yeah, it's true. It's kind of like the 7 great wonders of the world.
I know. I was so happy just to like check out the scenery in Miami and all the butts that were hanging out.
Yeah, they are totally pants optional. They could give a crap, and they literally walk around like that's kind of the style. That's the deal.
Yeah.
Hang it all out. It's
the
all
one
good.
thing I did notice, which I thought was interesting, was that by the end of my stay there, I didn't even notice it anymore. I was like, when I first got there, I was like, ooh, butts. And then by the end of my stay, I was like, yeah. Seen one already.
Yeah, that's right. I've seen a big one like that.
So there is something I'm realizing now to preserving the mystery, and because when you just let it all hang out there all the time, like it's not that exciting to see it anymore.
No, it's true, and I get that for sure. But it is it's interesting that the different parts of the country truly have a whole different emphasis on what is the body aesthetic.
Yes.
Facial aesthetics are a whole nother animal, but the body aesthetic of like Los Angeles versus Miami are two. If you took 20 people from the Santa Monica Pier versus 20 people that were on that boardwalk in South Beach, at Miami Beach and compared them, they look totally different.
They'd be totally different. And even like New York, a friend of mine that I saw a couple of days ago, she's living in New York. She lived in New York for many years, and she wants to have her breast implants downsized because she said they feel like they're too big, especially in New York, walking around with breast implants. And hers are, in my mind, fairly conservative already, and to her they're way too big. She needs to have them like half the size because that's the New York aesthetic.
Yeah, totally.
And if she came to see a plastic surgeon here, they'd be like, oh, you want to upsize those?
For sure. 600s will be good for you, man.
Yeah. So it's just every part of the country, every part of the world is different, which I think is great.
Yeah, and that's why, again, a meeting like the Aesthetic Society was great because we had those Miami plastic surgeons. They were talking about butt. The butt panel was amazing.
Oh, that was a good one.
Yeah, I mean, that was great because, I mean, there's so many ways to make butts bigger and prettier, and what the aesthetic is. They're too, like, they're too diverse to say, like, oh, this guy does this. I mean, everybody's got a different idea of what it should look like.
Right.
And I think that's where you have to kind of really talk to your patient and hone in on what they're looking for, because not everybody just wants these gargantuan butts, but there are some guys that if you go there, like, that's what you're getting.
That's what you're gonna get.
And so look at the Instagram and figure it out. When I do butt augmentations with fat, it's usually 400 or 500 cc's at the high end, and sometimes it's a lot less than that. But some people really want a lot. They want them humongous.
So it's all about the look.
Yeah, that was fun. That was a good part of it. I do have to say some of the food was spectacular.
The food, the nightlife in Miami is great. I'm such a lizard. I love warm weather and warm nights especially. So if I can go out and it's a nice warm night and I don't have to wear a sweater, like, count me in. I love any place like that.
Yeah, it was really cool.
But the food was excellent. The nightlife was great. The meeting was wonderful. I learned a lot. So 2 very positive thumbs up.
We'll go
Can't
next
wait.
year. Next year is in
San Diego.
San Diego.
Yep.
That will be a good one. Yeah, I mean, it's close by. It's easy to get there.
Yeah, it's kind of like, I could go to San Diego any weekend, but I am excited for the meeting. So,
but there are some great restaurants down that gas lamp district too, and the meeting will be great. So cool. And next year I will not be the president of the Rhinoplasty Society, so I will have an easy time with that. I think I just have to do the for the Rhinoplasty Society. I will just be the chair of the nominating committee. Which makes that a lot simpler.
Nice.
This year was very busy. So, well, anything else about the aesthetic meeting?
Nope. Just really glad we went. Had a great time. Looking forward to the next one.
Very good. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210. Cool.